Hello, I'm Dr. Walt Medlin. I'm one of the 3 surgeons at St. Mary's Duluth Clinic weight loss surgery program. I'm here today to talk about weight loss surgery. This is our usual talk that we give at information sessions. Thank you for listening today. We divided this talk up into chapters for the online version so that you don't have to watch a full video at one time. You can watch this at your leisure in different parts and pieces and go back and forth between the parts as they're needed by you. So the title of our talk today is Weight Loss Surgery, Is It Right for You? Is it for you? This talk is presented in information sessions by various members of our team, myself, Walt Medlin, Dr. Charlie Bertle, Dr. Jay Lenz, our program coordinator Christy Severson, our program physician assistants Tiffany Wallner, and Tony Valentine. Everyone is listed here in our brochure that is available in our program and throughout the SMDC system. Also, I'll be referring during our talk to our weight loss surgery guide book, which covers most of the areas I'll be talking about today as well. So, usually in an information session, we talk about scheduling an appointment. We usually have schedulers present at the information session to schedule appointments. For those of you who are watching online, I refer you to our website through duluthclinic.org to find the appropriate phone numbers, or if you have one of our brochures or the book already. If not, our general program number is 1-888-U, as in the letter U, lose, WT. Thank you if you want to call that number. We ask that people sign in when they do come to our information sessions. If you call, let people know that you watch an entire information session online. And we do have evaluation forms that we ask for people to fill out during our information sessions. So, weight loss surgery is a whole family of procedures that are designed to help people lose weight. And the reason that we talk about using a surgical approach for weight loss is that while all approaches tend to work in a short-term manner, diets, exercise, medication-assisted weight loss, almost none of them are durable. They don't last long-term. And in terms of overall health and lifelong improvement of your health and lifespan, only surgery has been proven to be effective. Clinically severe obesity, and we do use the term morbid obesity as well. That's what our computer brings it up as. I hope you don't take it as a negative or pejorative. It's certainly not the nicest term. We prefer to use clinically severe obesity. Is defined as a body mass index, which is a relationship between your height and your weight of greater than 35. Most insurance companies and the National Institute of Health recognize surgery as basically being automatically usable or proven effective in people with a BMI of over 40 and in people with a body mass index of greater than 35, along with weight-related health problems. Now, different insurance companies are different on that, and you do have to check with your own individual insurer. Some insurers still, and a few states, don't cover weight loss surgery at all, and some only cover certain types of weight loss surgery. The weight-related health problems that we see very commonly, diabetes, especially adult onset, not type 1 diabetes, but many children that are getting diabetes these days are actually getting type 2 diabetes, what used to be called adult onset diabetes. Sleep apnea, which is related with snoring and having your airway close off while you're asleep. A lot of people stop breathing several times an hour and don't even realize it, that they're having these brief wake-up periods during sleep. They can lead to daytime sleepiness. It can eventually lead to even pulmonary hypertension, which is an elevation in the blood pressure in your lungs, and even failure of the right side of the heart. Adult onset asthma is particularly related to obesity and is worse, especially with nighttime reflux, and that's what GERD is here, is gastroesophageal reflux disease. It gets much worse as people's weight goes up. High blood pressure is related to obesity, not completely. People who don't have a weight problem still can have problems with high blood pressure as well, but the rate of hypertension goes up quite a bit as people gain weight. High cholesterol and lipid triglycerides go up with weight, and all of these things are risk factors for heart disease, and in fact the risk for heart disease goes up as people gain weight. Other problems you can get are reproductive issues for women. Infertility is actually very common for people who are clinically severely obese. And that infertility usually or often reverses with weight loss, sometimes even very quickly. So that people have to be careful if they have not had to be quite so careful with their birth control, to be extremely careful after weight loss. Arthritis is not caused by obesity, but certainly the carrying extra weight around can be very hard on your joints and can speed the progression of arthritis. And certainly we have people coming in to take weight off so that if they have a joint replacement or an orthopedic operation, that they will have a better chance of success without having the extra weight on those joints. Urinary stress incontinence is very frequent among women, especially after having children, where if you sneeze or cough, you lose a little bit of urine, just a drop or two, but in some people that can be many times a day and can be really severely limiting socially and distressing. The risk of certain types of cancer also goes up with increased weight, especially endometrial cancer of the uterus for women, colon cancer for both men and women, breast cancer goes up measurably in women, prostate cancer in men, and kidney and gallbladder cancers as well. Now our program has limitations, and certainly insurance companies have limitations too for who qualifies for weight loss surgery. First of all, you do have to fit the body mass index criteria. We only operate on people who are under 450 pounds at this point. There are some programs that will operate on people who are larger. We usually find that with some work we can get people down under 450 pounds. Our CAT scan machine only holds people up to 450 pounds. We do have a medical weight loss program, and we can usually be very effective in getting people down to that rate, down to that weight, or we can help you find a center that has a higher criteria if that's an issue for you. We have age limitations in our program. We do not operate on adolescents at this point. There are a few experimental centers that are doing research work on this, and it certainly is effective in adolescents, but needs to be done under protocol at this point. I think that will be changing in the next couple of years, and we may even get on a research protocol at SMDC, but currently we're not doing that. We do not do gastric bypasses on patients generally under the age of 25 because of some of the stresses it puts on your lifestyle in terms of having to take daily vitamins and some of the changes that people can go through with rapid weight loss. We have found that they generally just do not tolerate those issues as well. We also have had an upper weight limit of the age of 65 for American patients because Medicare traditionally did not cover weight loss surgery, and most Americans were on Medicare. Our Canadian patients, we have gone over age 65, and we do individualize for our upper age weight limits. Our upper age limits for the program. We also recently have had Medicare come out with a nationwide finding that they will cover patients. However, there's a Center of Excellence process that our program is currently going through. We expect to have that. We hope to have that approval in the spring of 2007, so that we can cover we can operate on Medicare age patients as well. This is a chart just roughing out what a body mass index is for different height people. You can see that someone who's 5 foot tall actually has a BMI that will qualify them with a comorbidity at only 180 pounds. And certainly if you're a 6 foot tall male, that's going to be 180 pounds is not going to be clinically severely obese for you. So a lot of times we deal with this issue with primary care doctors who see a woman who's not 200 pounds and say, well, surely she won't qualify for operation. But if you're ill, if you have diabetes and you're in this range, or any of the other major medical problems, be aware of that. And there are calculators for this on the internet, and we have this chart in our book as well as in our pamphlet.